This is your Nurse Practitioner Board Certification Review courses. Important information about Prompt Review Academy. So, we have to know about this medication, steroid, because when you talk about Addison disease, we say that people that have Addison disease, they have low steroid. So, in order to treat them, you are going to give them steroid. So we usually give mineralocorticoid and glucocorticoid. But then people that have Cushing syndrome, they have a lot of steroid. So, and we know the side effects of steroid. So it's a very high yield in the exam. You need to know conditions we can use steroid to treat. Okay. Some of those conditions is like as an adjunct treatment for like rheumatoid arthritis, lupus, autoimmune disorder. So steroid, if you remember when we talked about um, polymyalgia rheumatica, which is poly, we say that multiple muscles is hurting the patient. So polymyalgia rheumatica is very important. We start them with low steroid, and this steroid, if you don't manage polymyalgia rheumatica, patient can because at polymyalgia they have multiple muscles hurting them. But when they start complaining about problem with their vision, it's not leading to temporal arthritis. So the difference is that when they have the polymyalgia rheumatica, you start with low dose steroid, you are monitoring their ESR, then they give it to them like 9 to 12 weeks. So one thing you need to know about steroid is that steroid you cannot stop it abruptly. When they have temporal arthritis, we give them high dose steroid. So steroid do not stop abruptly. So one of the questions can be if your patient is on steroid and patient stayed, I start feeling better and I stop my medication. It shows that patient needs extra teaching. Steroid cannot be stopped abruptly. You have to taper it off slowly. Then we also have skin conditions, and also they can also use topical steroid. Yes, we have we're still going to see it. Yes, topical steroid, which is the super potent, high potency, medium potency, and low potency. This is high yield in the exam. They can give you example hydrocortisone. So hydrocortisone, what type of or the topical steroid, the strength is usually low potency. Then we have the medium potency. Um, we have the triamcinolone is also a medium potency. Then we have the clobestol is a super potent, okay, high potency. So super high potency. So it's very important to know your steroid classification because you can be asked questions on that. And it's always good to use it. Sometimes you see the prescription, don't use more than 2 weeks, okay? Because sometimes it can cause more skin irritation when used in a longer time. Okay, so we have talked about what side effects of chronic use of steroid can cause. So when somebody is getting steroid, they may be at risk of Cushing syndrome. So remember those things that when somebody have Cushing syndrome, what it can cause them risk of osteoporosis. It can cause low immune system, which is immunosuppression. So they will be at risk of infection, and they also it can cause bleeding, and their wound will not heal. So very important. So this is the topical steroid usage guideline. Like we said, low potency steroid can be used for the face, granulous area, and genitals. Okay, so this can be used on the face, low potency. Then the thick skin areas, you use the moderate to high. So example can be which the following cannot be used on the face. So you can use like high potency on the face. So you need to know those guidelines. So we have the thick resistant thoracic plaque are sometimes treated by using occlusion. The topical steroid is applied to the plaque and is covered with the dressing or plastic wrap. So sometimes with the treatment of the psoriasis, so you can see that they can also use steroid. So you need to know medications that requires eye examination, very high yield. What are those? Those are the medications in the exam that you need to do eye exam. Very important. Example, digoxin. We talked about it. Digoxin. They can have yellow, green vision. Antibiotics. Ethambutol. If you remember ethambutol, we say E for the eye. So this is for treatment of tuberculosis. So it can cause optic neuropathy. Fluoroquinolones can cause retinal detachment. We have other medications you need to monitor the eye. Corticosteroid, it can cause cataract, glaucoma. We just mentioned that in other videos. Viagra can affect the eye. We say that because there is a reduced blood flow. Accutane, Topamax, um, Plaquenil. So those medications, know your medications that can affect the eye. So these are the medications you must taper off slowly. Medications you can taper off slowly. And one of the ones, like we have said, propanolol, beta blocker. Beta blocker, you have to taper off slowly. Steroid, you have to taper off slowly. So know the medications you have to taper off slowly. SSRI, you have to taper them off slowly. So all those medications you have to taper off slowly. You need to know them. So you can still read the rest of the slide, but I'm focusing more. So medications that can cause risk in pregnancy. You have to know all those medications, especially Accutane, isotretinoin, Accutane, very high yield in the exam. It can we say that before you start somebody on Accutane, you have to do we refer them. Accutane is used for severe form of acne. They refer them, but they still want you to know about isotretinoin. Isotretinoin is also called Accutane. They have to do check pregnancy test. They can only do there is no refill. So they give it to the patient. When the patient comes back, they have to do another pregnancy test. So before you give it to them, they do pregnancy test. When they come back again in a month, only 1 month supply, they have to do another pregnancy test. Another medication that should be avoided in pregnancy is Prosca, very high yield in the exam. We say that a pregnant woman should not even touch it with their bare hands. Other ones is the live vaccines. We don't give pregnant women live vaccines. So also know this one, flu mix. Flu mix is the flu vaccine that they get through the nose, intranasal, very high yield in the exam. They don't get live vaccine. All these live vaccine, measles, mumps, rubella, varicella, rotavirus, and flu mix, very high yield. They can't get it um, in pregnancy. Okay, so these are commonly misused substances, and note the ones and what they can cause. For example, the opioid, It can cause respiratory distress. I'm more focusing on cocaine. Cocaine for the exam, it can cause nosebleed. They can ask you which of the medication can cause nosebleed. Cocaine. You can read up the rest, but more important for the exam. Then herbal supplement. Herbal supplement. You will surely have questions on herbal supplement. So know all the herbal supplements because you don't know the one you will get. Is Chinache or Echinacea, whatever you call it, Echinacea. That is the one we use for flu. Okay. But you need to avoid it for patients that have autoimmune disease, echinacea. Okay, that is echinacea. So we use it for flu. Another one is feverfew. Feverfew is used for migraine headache. Migraine headache. Cinnamon. Cinnamon helps to improve the blood sugar and cholesterol. Glucosamine is used for osteoarthritis. Ginkgo biloba is for memory, dementia. But we say that we need to stop taking it 2 weeks before surgery or 7 days before surgery because of the risk of bleeding. Okay, then we have the natural progesterone creams, which is like your soya bean, isoflavone. Then we also have isoflavone. We have the saw palmetto. Saw palmetto is for BPH. Okay, BPH. And kava kava, kava kava, valerian root or valerian root. We use them for anxiety and insomnia, but you need to remember that you cannot mix it with CNS depressant. So you cannot mix it with kava kava because if you mix it with kava kava, you are worsening sedation. So it's like giving the patient overdose. St. John's wort. St. John's wort is what we use for depression, but also know that it can also cause SSR and serotonin syndrome when you mix it with SSRI. So remember all those points. So your herbal supplement is high yield in the exam. Turmeric is used for cancer, arthritis, Alzheimer disease. Okay, then we have the fish oil, omega oil. So those ones are used for high cholesterol, niacin. So for US health statistics, so number one cause of mortality is heart disease. But what cancer? Number one, when you talk about cancer, is the number three is the lung, the colon, and the pancreas. So number one cause of death is usually heart disease, irrespective of the age of the sex. But when you talk about specific for the sex, it's usually lung disease. So if you talk about the cancer, the cancer is lung disease, colon, and pancreas. So this is the leading cause of death by the age. So 0 to 12 months, congenital malformation. 1 to 44, unintentional injury. 45 to 65 years, cancer. 65 years to heart disease. Okay, they can ask you a question on this. You just need to know that sensitivity and specificity. So, how I remember it is that a sensitive test is very good at identifying or detecting those people who have the disease. So, the people that have the disease is the sensitivity, people that have the disease. But specificity is very good in identifying those without the disease. So please, the people without the disease is the specificity. But people with the disease, so the people that have COVID-19 is sensitivity. But people without it is specificity. You must know your levels of prevention. Primary prevention is about prevention. It always has to do with education. Anything that will reduce the risk of the disease. For example, diet, exercise, seat belt, immunization, national program, all these things are primary disease, primary prevention. Secondary prevention is anything about screening. You do a pap smear, you do mammogram, they are all anything screening. S for screening, P for prevention. Then tertiary is anything you do to reduce the impact of that disease on the person. So anything you do to improve the quality of life for that patient. So like rehabilitation, support group, education. So for example, let's give an example. A patient, primary prevention is anything you can do to prevent the patient from having diabetes. So that can be education on healthy eating, um, anything they can do to prevent diabetes. That is prevention, education. Then screening is your which is your secondary prevention. That is now your what? A1C. When you do A1C, okay? Then tertiary prevention is if this patient maybe have finally had um diabetes and you send them to support groups, people that have diabetes, and the person is learning how to manage their diabetes or whatever you are doing for this person to be able to manage their existing disease, then that is tertiary. Then we have our USPSTF screening recommendations. So all these screening recommendations when they can start, okay, is very important when they can start. Different guidelines like breast cancer, cervical cancer. We already know that from the age of 21, they start pap smear. When we did women's health, we look at this HPV in detail, even normal cancer, Oscars US, Oscars high, HSIL, and low SIL. We know all those things when we did women's health. We know the guideline and what to monitor. Then the breast cancer, they start at the age of 50 and you repeat every year. But if those people have the history, they usually start at the age of 40. So lipid, they start at the age of 40 to 75. So we have colorectal cancer starting from 45, lung cancer, and please, lung cancer, remember this, the annual screening with low dose CT. Please remember that, very important for the exam. Then the prostate cancer, we said that prostate cancer, we have a guideline for prostate cancer. If you remember men's health, we say that if they have a average risk, high average risk, and the risk. So people that have a African American and family member that have prostate cancer, so they need to start African American family history. They need to start as early as 40 years, and you also need to know the PSA level. We said greater than 2.5, check every year. Less than 2.5, greater than 2.5, check every 2 years. Less than 2.5, check every year. Greater than 4, we say to refer. Greater than 10, biopsy. So please remember your men's health.